Good. You never know, you know?
I have some hair.
Oh, okay. Okay.
Doesn't mean I'm wearing them.
It looks good, you know? Just in case someone else needs a mask, it'll be fine. You're covered.
Today I
Hello, hello.
oh, there's a mask here in the car.
Yep, this is a class. This is these steps to pain-free walking today.
Okay.
That is the class. You're in the right class, I think, right?
I don't know.
Yep, sign in wherever the sign-in sheet is. Take a handout. We have handouts there, outline of the I call it the show, but the workshop of today. We talk about exactly when you walked in today, did you observe how people walked? Do people walk normally? Just demonstrate, right? I'll demonstrate it for you. Because I tell my patients all the time, when you walk, I don't want to hear you walking. So I don't want you walking like this, shuffling your feet, okay? Or even stomping your feet too. If we do that, what happens, all that pressure goes to your knee, your ankle, your hip. I'm a chiropractor, but I don't want to work that hard. I'm busy enough as it is. All right, so I want to make sure we're walking, just to demonstrate again, we're walking more heel to toe, where you don't hear your steps. That means your body mechanically is working like a spring to push yourself off the ground. We're walking too, we almost want to walk also on our heels, and I'll go over in a second how to do that, how to set your posture, on your heels more versus on your toes. What looks better, this or right? Let's keep our body here and we'll go over exactly how to get there. So if you have foot pain, if you have ankle pain, lower body pain, you can heal that mostly on your own. You don't even need me after you see my workshop today. All right, simple stuff. And if you're first time seeing me at the very bottom there, I'm going to repost this on YouTube later, probably tonight if I get home on time. Let's go down to Carl's bed, come back up. But if I get back on time, post it tonight, latest by tomorrow. You'll have it on my YouTube, so you can go there and check it out. All right? If you don't know what YouTube is, don't worry about it. You're saving yourself a lot of headaches by not being on there. So number one thing, check your shoes. Okay? When you check your shoes, you want to do, I washed my feet today, so it should be okay. You want to do is make sure if you're walking properly, the back heels of your shoe should wear out evenly. That is the plan on both sides. So I want to do is take both shoes, preferably the same type of shoe or same shoes you wear all the time, and check. Do both sides, my heels here, yep, you just made it on time, perfect, we just started. Here on the back of the heels, are they wearing out evenly? Or is one side more worn out than the other? If one's more worn out than the other, that's usually your longer leg. Okay, meaning that some people's legs are off by a quarter, half an inch, sometimes more, even a full inch. That could be somewhat corrected to a quarter of an inch, but sometimes we're still going to be off. Okay, so what I do is I always wear here, do I go over more down? I do it more down level right now for one too. With your shoes, if you have problems with feet pain for one, or ankle or foot pain, check if your shoes are worn on one or the other. If they are, that may be your lower leg. I'm sorry, your shorter leg. So if my shorter leg is on my left, I'm going to walk more like this sometimes. I'm going to feel like I have to get that pelvis to almost shift here to feel balance from my head to my pelvic area. Versus my feet are even, I'm going to stand more straight up and down. So can I have, I'll check if you want me in a second too. If you have short leg or not, we'll get that out of the way. But overall, if you are, this is one way to notice with your shoes. And if you do, what I do is put an orthotic in my shoe. I'll go over this now instead of down the line in the workshop, is I always wear orthotics in my shoes. Helps your arch support. Buy them online for like $10 on Amazon, wherever you want to get your stuff, for one, too. And if you also, too, you can either buy the full one for your full shoe, or you can buy a half one also. That gives you a little bit more expensive.
I wear this kind.
Perfect. We match. Like my twin sister over there.
I wear this for about 25 years.
Yeah. If you have a dropped arch, it can cause your legs to be off too. If your feet turn in or out, also we'll talk about that in a second also, that can cause a drop leg or a drop hip, causing foot pain or heel pain.
My pain was here.
Okay. Okay.
Sometimes, you know, I have to take my shoes off
Ah.
in the street
Uh,
to make another step.
just don't lose your shoes if you're in the street. People take your shoes all day long, if they're good shoes especially. So you want to make sure you have a hard, if you have an orthotic or want to get one, my recommendation is make sure the middle part of the orthotic is hard plastic so it doesn't bend. If you get a soft one, you're just gonna drop that, not gonna be very effective. And then,
Mine is hard plastic.
that's what I like these, hard plastic, same thing, hard plastic. And what I do normally, I'll either keep the insert of the normal shoe in there, but if it's too high, I'll take it out.
But why my pain wasn't here in the front of the front?
I'll have to check your podiatrist records afterwards and see. I'll have to check and see. We'll find out. Any questions about orthotics? If you walk a lot, good to have them in your shoe just to keep your feet healthy, a preventive measure. And if you have problems, good to look into them and see. Okay, especially if you're more flat-footed per se. All right? Just my little recommendation. So now, as we go through this, is how is your overall posture? Talk about a second. Now, when we stand, are we standing here? Are we standing more here to one side? Do we also have our foot, let me put this up a little bit so people at audience at home can see, here. Are we also standing to where, if we're standing, we feel straight, but the problem is now our foot might be turned out a little bit. So now I stand this way, dropping that hip. So two things. One, make sure we're standing straight and our body's coming back with our feet coming straight out, not one foot turning in or out. So just watch that and see. So setting, yes, Sylvia?
I'm not aware of it.
We're gonna check right now. We're gonna find out. We'll see. So now, here, how do we check posture? Okay, how do I know? Of course. Grab a seat, take one of the pamphlets. Do we have our handouts for today? Goes everything we're talking about today, also next month's talk also. So how do we know if our body is here, here, or even here too? The problem is when we do it all day long, that's our normal, right? That's what we normally feel. That's our default, you know? So what I want to do is reset everything. I'm going to go against the wall with my heels, hips, shoulder, and head. Tried to hit a nail or something on the wall here. Here, I put my hands by my sides. At that point, that should be ideal. This is how you want to set your posture to know where you are versus ideal. Is come against the wall again, heels, hips, shoulder, and head. Stand there for about 15, 20 seconds. That's ideal. If you feel tightness in the shoulders and neck, that means your head's too far forward. If you feel your lower back feels tighter, sore, uncomfortable, that means your back is hunching too far forward this way. So you want to really know, okay, if I'm here, does this feel relaxed to me? Or does it feel something's uncomfortable or tight or sore? And once you're here, to stand and walk properly, move properly, by proper gait pattern analysis, is now you want to do is take a step forward, weight on your heels so we stay back here the whole time when we're standing. And when we take a step, we want to do is walk heel to toe when we're walking. Again, not heel to toe, not here. Different, right? Different. And when I go heel to toe, now I'm rolling my feet like a normal spring would be. Here, I look kind of graceful, right? Right? Look graceful? Okay, I know manly, but graceful is good too. All right? Can you be manly and graceful? Yeah, you can be, right? Manly and graceful, right? So we're rolling our feet. We're almost feeling there's not a lot of we're not kicking the ground. We're not stomping on the ground. We're not causing pressure in our foot, knee, ankle, and hip, and even lower back too. Yeah, that one's they're gonna wear their shoe out faster if they're doing this, and you're causing your biomechanics to cause more knee pressure too. You're causing a lot of friction on the floor. Now your knee feels more pressure. Tell my patients, I don't want to hear you walk in the office. I don't want to hear you stomp, or whatever it's called. Just shuffle your feet.
Yeah, because we know that people who's walking around.
Yeah, I can hear them in the house. I'm like, you don't do that on my floors, especially. I have to clean my floors all the time. So again, last time, heels, hips, shoulder, and head. Check your standing posture, come off the wall, and then stand on your heels and walk by rolling your feet. Heel to toe. All right, any questions about that? You're going to walk out here like, am I walking the right way? Yeah, you will, you will. This takes patient maybe 3 weeks to kind of reset their body. Depends how far they're off, depends how symptomatic. Sometimes if you've got a lot of back pain, it's hard to lean back. So I'll adjust them with the chiropractic adjustment. They'll go, oh, now I feel I can do this again. Their body's not used to it. All right? Any questions yet? Sylvia, questions? I see your brain thinking over there. Okay. Who wants to be my first model for the day?
I wanted to see it, but you already told me that
Remember last time I did the hip thing with you, right? Your feet are off, correct?
yeah.
That's
So
right.
I want to know how much.
Well, let's find out. So how do we check leg length? So I'm going to have you go on your back for me. And then I don't have a roller for your neck. Is that going to be okay lying flat?
Yeah.
Okay? All the way back. I want to have my patients relaxed, and I want to see is with their shoes on, are their feet even? So you can see Sylvia right now. What I do is bring the heels together and then toes together so it's more even in their overall body. Then from there you can see hers is off maybe by 1/4 inch, higher and lower.
Okay.
So what happens, okay, if I touch your hips?
Sure.
Higher and lower. Just exaggerate it. Okay? The problem is when we're higher and lower, the biggest thing is we're not going to walk in a circle, right? Now we're going to do this. Now we're going to do is shift our hips to feel like we're even, like we're walking even. So if someone's higher, lower, I'm going to almost feel like I'm doing this, not here. All right? So with Sylvia, what I did last time is she's going to now, her stretch we'll do here, is how do you make, if the hips are higher, lower, we want to make sure the hips go from higher, lower. Want to make sure I would get the hips here and the hips back here. These joints back here between your tailbone and your hips, and your joints in here, from our head sit in your hip joints, your ball and sockets, we make them looser. Okay, so let me have you do, which is the bad hip? Which is the bad one? Okay, let's do this one first. What you do is bring your figure 4 here, bend your knee, then bring your knee out this way. I call it a figure 4 stretch, and just push this down this way. Either you can do it seated or lying down, whatever's your comfort level. Okay. Once you've gone this about 30 seconds, on one side, figure 4, stretch the front hip. The front hip and your hips, like your shoulders, are like a piece of rope. They wind up. Hips are wound up. You want to unwind them this way. Want to stretch the back to the piriformis G medius muscle. What I want to do now is now bend your knee. Now with this hand, Sylvia, grab your knee and push it over this way. You can do this before you get out of bed. But when you get into bed,
You hold it for 30 seconds?
hold it 30 seconds. 30-second hold on both sides just to get everything loosened up. The stretching, when you hold the stretch versus the movement stretch, is more for ligaments in the joints versus the muscle itself. Get some muscle too, but more ligaments to hold that tension stretch.
This is almost the step that you showed us last week. Remember the
A
one?
little bit different because I was more leg off the side last time. A little different, this is different. More for the front hip and back hip, especially if you have tight hips, making you feel like one leg is higher, lower. 1/4 inch, nothing, easy. When you have 1/2 inch, 3/4 inch, a full inch, talk about getting a lift like I have my shoe over there. All right, that feel okay?
That wake me up.
Oh, good. I heard you snoring over there. So try this side too a little bit if you're comfortable with it. You can bring that ankle over the knee. And now drop this a little bit tighter, as you know. When was your surgery?
8 weeks ago.
8 weeks ago?
On the 15th. No, what's it, November 15th? Yeah.
So about-
November 15th.
So about a while back.
Almost 2 months.
At least 2 months. So here, 30 seconds. Then switch sides again. Now bring that across this way. With this hand, there we go.
So my question is, I have 2 new hips.
So if you go ow, go right below the ow. Hold enough tension right below the ow.
Should I even be doing that with 2 new
If you feel comfortable doing it. Because you're lying down, you can't hurt yourself. There's no vertical load.
I just don't want to pop out.
Well, that would suck. Check if, are you seeing a physical therapist now?
I'm finished.
Yeah, so then you're good. They've done the test with you. You know what I mean, yeah. But try it and see, and only go, again, where you're comfortable. Feel the tension, hold the tension.
Right there.
Don't go where it's uncomfortable. Then start there.
Because we don't have to be in pain to do
No,
any
this is not post-collapse pain. It's supposed to be, when I say uncomfortable, It's because I want you to feel like you're causing a change in your hips, not causing just the muscle to feel okay. If you want to make things to stretch and lengthen and get the ligaments to unwind, we have to be a little uncomfortable in that process. Grab a seat if you want. Grab a seat, grab an outlet or outline, blah, blah, blah. All right. Good. Any questions about that?
No.
Good? Come on
I'll
up.
talk to you later.
Good. Let me know. Let me know.
Because it's after the surgery. It's just a pain right there and here at the same time.
When you take a step?
No, when I lie down in bed.
Okay. So that stretch will help out here and here.
And that's what?
It's your TFL band here. It's too tight from the surgery. Your muscle's recovering.
Yeah.
So you want, when you take a step, that TFL band allows you not to bend your knee, your hip out.
Sometimes when I walk, it depends on how I walk in. I'm going to walk in.
So you almost want to, for yours, for that TFL band stretch, you almost want to lock the knee out a little bit and now bend the other way.
Okay.
So bend to your left to get that to stretch.
But at night when I'm trying to sleep,
So that stretch will help a lot before you go to bed.
it goes away like in 15 minutes.
Yeah.
But it's,
It'll help a little bit. Yes, ma'am. Of course, of course, of course. Let's double check, Miss.
Do you see the difference in the tennis shoes or any kind of shoes?
Doesn't matter what kind of shoes, as long as it's not high heels.
Oh, okay.
I don't wear high heels very often.
Okay. Let me put my phone in here because.
Just on Saturday nights when they go dancing. On your back all the way. So here, same thing. I'm going to bring the heels together first and then the toes together. You're off maybe between 1/4 and 1/2 inch.
From which one?
Higher, lower. So right now, higher, up, lower, down. So you're going to feel more on this side too. So bend your knee here and then here. Then with your hand here, push down on your leg like that. There's the face. When I have my patient do the stretch for the first time, I want to see their face. I want to see where they feel uncomfortable by causing a little and then I bring it back just a little bit. Because if they're feeling good, I go, hey, you're not causing much of a change. Feel uncomfortable. I saw your face. So here, 30 seconds. And then leave your foot right there. Now bring it across this way. Hand here and all the way across. So you make, there's the face. Perfect. You making the face? Good? That's the face. 30-second hold. To make these muscles here stretch all the way. G medius piriformis, part of TFL band also. That'll help your TFL band here on your right side, Sylvia. Loosen up from all the walking you do. I know the LA Marathon's coming up in March. You got to get ready for the LA Marathon. All right? That's the plan.
To the left is high.
There you go. See? So, and when you have a higher or low, you're going to have a tighter and a weaker side. So always stretch both sides evenly.
what time of the day do we do this?
I like mornings.
Okay, where are you playing for when
Because in the bed, because when we're sleeping, we don't move, right? So everything tightens up on us. That's when I feel the most rigor mortis in the mornings when I wake up. So I want to stretch before I do anything, then go work out. That's usually my routine. 15 minutes, boom, jump out there. Here and also here.
That means when it's low, it's correct. And when it's high, it's not correct.
I'm going to go, when it's low and high, it's uneven. But the high side tells me that side's tighter.
Okay.
So I want to stretch the tighter side, but I want to stretch both sides so the side's not jealous.
Why is coming not even?
Everyone's different. Everyone's different. Some people have driven a lot. When they drive a lot, they bring that left foot back, right from the pedal, so that everything stays shifted.
But I don't drive, I walk all the time.
So you walk in a circle? Coming up? But yeah, that'll help that stretch.
So I have the pain in the left side, huh?
Left side, and it's tighter there because pushing everything back this way with the hips. So it's not, again, it's not just the unleveling of the feet, it's the hips shifting. So if my foot's higher on my left, I'm not going to stand like this. I'm going to get my body to recenter itself by causing my hips to shift this way so I feel normal.
So that means I have to do this exercise
Every day.
more in the left side,
Both sides,
both sides.
because you want both sides even. And do them days that end with Y.
You can feel the difference here.
See, hear me? Do days that end with Y. Those are your stretching days. Which is which days? I just want to make sure every day is with Y, right? So, and then, especially if I'm going to go for a long walk, do I want my legs uneven or even? I want to start my walk with my legs being even, right? So keep your stretching. So if I tell my patients, have them start working out, being active, whatever they want to do, I tell them whatever activity you want to do, stretch first, And if it's sore afterwards, ice after. So you want to have your routine down all the time. I'm going to do my thing, stretch first, ice after. If it feels like it's more just tight and not sore, I'll stretch first, activity, then ice after. Or heat after. I'll usually try to say. So now, knee pain. So knee pain here, if I have knee pain, where's knee pain most common, you think? On the middle, outside, or inside? Sylvia, yours is outside. But you're a rarity. You're a special person. Sorry. So inside is more common because the inside, it's one thing. Your quad muscle, right? You have your quad muscle split in three different muscles. Your magnus, lateralis for lateral, and medialis for middle. Or inside knee, medialis. So the problem is the outside part of the knee has your TFL band, a separate muscle that supports the lateralis already, so it pulls everything outside when you're walking. So you want to make sure the inside is usually the culprit where it gets weaker and tighter and more painful. So you want to make sure that the inside stronger. Okay? So what I have people do is say sit on somewhere you can hang your feet, and without using a machine, do three things. One is bring your foot straight up to start. That allows you to work the whole muscle. When the kneecap comes straight up. Then I'll have you do is now bring your foot in to work the outside muscle to stretch it. The outside's tight or sore. Foot coming inside now pulls probably 10 times. 10 times. Start with five. But at that point, so one here, one inside to work the outside muscle to get it stronger and looser. Now the inside, have you do is now bring your foot out to now bring that foot straight outside to work the inside muscle. Opposite. Also, I'm doing this initially just without any weight or anything. And then if you want to use a band, and if you want to use a machine. Because when we're walking, this muscle takes over, so we naturally get that to pull out, causing inside knee pain. So this one, inside knee pain, work the inside muscle by pulling your foot away from the side of pain. All right? And if you feel comfortable, even you can do is, it would be more the inside. If you want to also, if you're comfortable, you can also is start doing what's called sumo squats, where you go here, either against the wall or hold something, and just bring your feet out. Instead of being here to work the whole muscle, work the inside muscle, bring your feet out, bring your knees forward to come straight down, hold for a second, then come straight up. All right, just work, wherever you're comfortable. Come down here, hold for a second. Once you feel the pressure in your knees, then come back up. Just work, But now I recommend doing this maybe twice a day. Again, if you're going to walk, especially do it first. If you're going to be walking. All right? That's the plan. All right? Everyone. This is what I do with my patients all the time. Okay? Also, too, talked about that. Yeah, so feet stretching. Okay, how do you stretch your feet? What I mean by that is you have your arch, right? Foot arch. Have your Achilles tendon comes across here. From your arch becomes your Achilles tendon, triceps surae, and calf muscle. Gastrocs, whatever it's called. All right? So you have 4 different segments all connected. So if I'm tight here causing pain here, I want the whole muscles to stretch. So what I would do is take that again, some of that solid like a corner of say a bed or a couch, even a chair, and just hold that pressure just like that with a shoe on, lock your knee out, and slowly come down. Slowly come forward, go this way as you're comfortable. Because you have the shoe on, easier with the shoe on, allows the knee to lock out. Now the whole muscle is under tension, so as you bend forward, now the foot arches further back. Feel that tension. Okay, same thing over here to see it. Just one spot. Here, let me adjust this. Here, same thing. Coming down and leaning forward, so the foot comes more toward the leg to cause that whole muscle to stretch. Just work. Hold about 10 seconds. Relax for a couple seconds, 3 to 4 times. All right? Any questions about that? Simple stuff. You guys are all like, whoa, this is magic. What's going on over here? Now, how do we talked about walking, rolling your feet? How do we practice rolling your feet if it's not common to us? For example, I have patients come in with previous hip injuries or surgeries, knee surgeries, foot surgeries. So you have to relearn. If I'm a stomper, or if I'm a what's it called? Shuffler for 1, 2. I want to slowly learn how to roll my feet. I'm going to go here, have one of my patients sit here, go on one heel and one toe, and slowly roll back and forth. Rock your feet to sleep. All right? Allows you to reset your brain without looking at your feet. Don't look at your feet. Reset your brain to walk like this over time as reset how your gait pattern happens when you walk. Simple stuff, right? Not really for some people. It's a relearning process. You know? That's what I tell people. Maybe about a minute or so, just rock your feet. Work the muscles so you feel that roll of the foot the whole time, not just the stomping. You feel the whole foot working. And I like doing this with the shoes off because there's more sensation on your feet, on the skin. So it actually picks up those nerves, pick up how to reset everything. All right. So next, once you've done this, we want to make sure, again, our feet when we stand are even, not one foot pointing out or both foot pointing out. Again, if our outside muscle TFL band is stronger, it's going to naturally over time pull our foot out. We won't even notice it. All right, so we want to make sure, again, we roll our feet are straight. When we stand, how are we going to learn how to walk better? Have people do initially. Go against the wall. All right, and by doing that, allows them to really see. I'm going to move this right over here. A little tight today. There we go. Here, how this works. Have people go against the wall and start with one foot on their heel. And slowly roll forward, head up the whole time. And as you roll forward, so for example, my left heel's up right now. Left foot drops on my toes. My right foot comes all the way up. So I'm allowing my both feet to work together, standing with more load, more pressure, as I get that to reset the muscles and joints of my lower body. Realize your joints of your hips, your lower back, your whole spine is going to be affected, right? So you want to make sure our body's up the whole time. So if you need to, you can start with going against the wall first, there, then come off the wall, and now start rolling your feet so your body stays up the whole time. You know our focus is here, our whole body's being affected. If I'm here doing this, not very good. Don't do that. Negative. You want to do, once you've done that long enough, feel comfortable both sides, maybe 10 times both sides, shoulder feet back and forth, head up the whole time. Hand the wall for balance for one. And from there you want to do is now start walking heel to toe slowly. At that point your brain resets its balance point here. And your feet see the movement. So you want to do now, hand here, one step forward, roll for a second, pause. Other foot comes forward, roll for a second, pause. About 4 to 5 steps. Why do you want to go slow? Or just get it done? Why is slow important?
Does it stretch more?
Stretches more, and your brain has to work hard to reset your balance. If I'm just doing this, la 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 la, I'm good, yeah, whatever. But if you're doing slow, then your body picks up, okay, what muscles are working? Why are we pausing? What muscles have to hold our balance for 1, 2? We're retraining our balance here slowly, so all these muscles know how to work properly in a slow position. They can reset themselves. Just time. Okay? So here first, hand on the wall, roll back and forth, about 5 to 10 on each side, for one also. Done that, then take a step forward, drop your foot, bring the other foot up, take a step forward, drop your foot, bring the other foot up, and about 5 steps on each foot. Work the muscle. Again, shoes off to really feel that sensation in your feet. Any questions yet? Who wants to try this? Any volunteers? Come on over. Might as well, right? Everyone has to volunteer once a year. That's why she volunteered you. What's your name again?
Deborah.
I know Deborah. I know you from before.
Yes.
So come over here for me. Hand on the wall. Scoot back more, scoot back more. What I do now is bring that left foot forward and then slowly roll back and forth, head up the whole time. Don't look no cheating, don't look at your feet. Back and forth about 5 times, and then switch sides. Right foot up, just roll back and forth 5 times on that foot. Does that feel okay? Mm-hmm. Good. Now, right there, I want to slowly take your left foot forward and then drop it. Hold for a second, bring your right foot up. Now switch sides. Right heel, come up, hold for a second, and then here, and then all the way up. Does that feel okay?
Yeah, good stretch.
Yeah. It gets everything to kind of stretch and move for one, too. That's the goal. Yep, thank you. Appreciate it. Sylvia. You get Sylvia next time. Any questions at all? Any questions? Any questions at all? What do you think? Is that helpful? It's work, and if you wanted to, you could. Once you feel comfortable going forward with your steps here, you can. Once you go forward, you're comfortable. We got it pretty down. Once you're done, you can start walking backwards also to prevent injury. How many people fall going backwards that you know? I know.
She's an expert.
Yeah. People they lose their balance, they know where to go. Might be a curb too. So if you can train your body to feel what going backward is really like, okay, I got this. You're not going to panic. I had a buddy of mine my age, I'm 50. He's 52, I think. He stepped off a curb backwards, broke his ankle. Right now he's going to do a 3-legged race because that's only how he has one foot. That's it. He's done. But make sure that we do enough stretches every day, loosen things up, and I don't care if it's this one of the ones too, that you start your day with a good stretch so you have a good day. Again, walking is going to be, again, just to repeat, we want to walk with our head up and walk heel to toe. So at that point, our body stays up, not here. I come down Euclid for work. I see people walking Euclid like this the whole time. I'm like, my next patient, perfect. I'll give him a card. But can we get our body up here? So the problem is, no one sees me as a chiropractor until they have pain. Right? Like, I'm not coming in just for a posture check. No, they're not. Because they've been here long enough. They've walked this way long enough. Now they have problems. So our brain has learned one default position or motion or biomechanics. We have to retrain that. Give yourself, be patient about 2-3 weeks to get your body to reset itself, then maintain that. All right. Any questions? Nothing? I don't know. That's my show for the day. Tip your waiters and waitresses for 1, 2. But make sure you just practice these things. And next month, what's the topic next month?
Okay, when I lay down,
One second. So next month is going to be learn exercises for back and hip pain recovery. Boom, check me out. At that point, let's go over everything, right? And a lot of these exercises you'll see will repeat themselves what's this one? Do you have one of these?
What was that, hip and
It's hip and back pain recovery. Give you one of these.
what day do you have?
You have one of these?
Oh, no,
It's on there. It's on
I
there.
thought this was this
No,
one.
no, no. We have plethora of paper everywhere. That's what we do. We give paper away here. By that point, learn how to stretch. And how often should we stretch again? Every day that ends with Y. If you know a day that ends with Y, let me know, because I don't know anyone. Yeah, it's all these little things. All these little things pick up, right? And if the problem is, if you don't stretch, what happens? Within 24 hours, rigor mortis kicks in. That's not good. Avoid that. Rigor mortis is a bad thing, right? Keep moving.
So when people wake up with leg pain,
Yes, cramps.
legs every day,
Yeah.
is there something lacking in your system?
Sometimes hydration is part of it, but more stretching before you go to bed. So if you have cramps at night, make sure you stretch before you go to bed. You know, make sure you stretch. If you have cramps in your legs, make sure you stretch before you go to bed. Yeah. And remember, there's an old remedy too for if you have cramps in your legs before you go to when you're sleeping. What can you do? Put a bar of soap in a Ziploc bag at the bottom of your sheets, underneath your sheets. It helps. It's an old home remedy from some ancient times. Back in the 50s, I think. I don't know. Bad 1950s, the old times. You're welcome. Have a good day. Do your thing. Yes. What kind do you want? A Dove? The white Dove soap. Yeah, right? Yeah. For some reason, Dove soap has some type of magic panacea in the soap. It's Dove soap, the white one. Where you're lying down in bed, when you're in bed, at the bottom of the sheets where your calf is. So if you have that, it would be right here, or if it's your knee, where your knee is when you're sleeping. That's what has to be the white Dove soap. Yep. They may have other different colors, but I think the white one works the best. That's what I was told. Hey, whatever home remedies are out there, they've worked for a lot of years. They work. I don't know. It's magic. I don't know. Thank you guys for watching.